Okay, well, let's just start off. So I think let's spend a couple of minutes on barriers, then a couple on drivers and leaders that we've got, and then we'll spend most of our time on priorities, like what are we going to do about it type stuff. Is that okay? So who wants to start? Give me a bite. I'll tell you what I'll do. I've got a thing here where we can pop some notes on, and I'll pop the notes on, but I don't know if that's going to be distracting for everyone, so I'll keep it up for a minute, but if it's annoying, let's just go back to looking at our lovely faces. Is there anyone who wants to start up? It's took the names off.
I'll give it a start.
There you go, go on. Sorry, what's your name? It took the names off the thing because I've moved to sharing.
It's Dermot.
Dermot, sorry, thank you. Go on, Dermot, what were you going to say?
Okay, so the barriers at the moment are, to my mind, a lack of understanding of what is going on already, or lack of knowledge, you might say, and then a lack of coordination around that.
Sorry, go on, David, go on.
Yeah, so if we, there are loads of people who are doing things, and there's a growing movement of people who want to do things or to ensure that it's somehow coordinated. But if we don't know who's doing stuff and we haven't got any particular leadership on that, then how do we pull all that together? I think there's also another barrier would be a lack of understanding or the lack of detail in terms of what the challenges actually are. Everyone knows that it's an issue. Everyone knows that there is exclusion from digital at the moment, but where is it? What is the problem? What are the particular barriers? We know what the types of barriers are, but where are those barriers most acute, and where is the greatest need? So if we understood our place in terms of where the need was, and we understood what it was going on already and who was doing it, then we could look at somehow coordinating those activities and addressing the greatest need. Now, for me, as a program manager of the digital program within health and social care, I'm trying to coordinate some work stream on this to try and pull things together. But I've really got no idea where we start. I'm trying to get this off the ground for the last year. Finally got a little bit of leadership. Finally got a little bit of buy-in. COVID has moved things quite significantly. But what do I do? Where do I steer people towards? How do I pull all this together? I've got some senior people now who are interested and want to drive it forward, but at the moment, all I can see are barriers, and that's just mostly down to ignorance. And I'm hoping that people can enlighten me, and we can collaborate and start finding out a bit more.
So excellent, thank you, Dermot. So at least 3 really good barriers there. I guess your kind of working assumption is there's some stuff going on, but I don't know what all that stuff is. Yeah. Where do I house all that stuff?
I know what Ian's doing. I know what people are doing around Solidaritech.
Yeah.
I know what some of the stuff that some of the primary care practices are doing. So yeah, there is stuff going on. It's just where, what's the whole picture? And I know a lot of voluntary sector organisations are doing stuff as well and had funding more recently to do stuff too. But it's a tip of the iceberg, I'm sure.
Yeah, thanks, Dermot. So I guess, has anyone got, feel free to disagree with Dermot. I doubt you will, but feel free to disagree with Dermot. There might be other problems there. But has anyone got any other barriers that they wanted to raise as well? Ian, go on.
Yeah, so just picking up a point that came out of our breakout group, and something that's always on our mind, is that when you take digitally excluded people and you give them inclusion, what are they going to access? And that's where a lot of, it's talking about loan sharks, and that's why we're doing our big Loan Sharks and Monsters campaign just at the moment, is coming up to Christmas, coming up to Halloween. We know that there are people out there that are using social media to entice people with very quick and easy loans that are never paid off. Just in the last week, we've heard of a major national organization that a legal lender that's charging 500% for a £500 loan in the lead up to Christmas. So these are the sort of things we're looking at and exploring at the Anti-Poverty Events Group. And what we'll be exploring with Safer Internet next year is, yes, we can get people hooked in. That's absolutely great. What about the education that goes around that to enable people to use it for the good things that are out there, rather than get enticed and down a rabbit warren of problems? So education is key.
It's a really good point. This idea of it's all very well getting people to the gate, but then if you
Yes.
just leave them, you don't know what's on the other side of it. Yeah, it's a long.
And that's what's happening. That's what's happening, Peter. We're seeing that more and more. Even in our credit union, we get more and more people coming to us saying we're up to our eyes in debt. We were fine. We were working, operating really well. We got online. I got into gambling. My husband got into gambling. The financial abuse, domestic violence,
Yeah.
all the other things that go along with that. The drive to get people online should be tapered with the education, and there's no money for that.
Yeah, good shout. Tabasam, you put your thumb up. First of all, am I pronouncing your name correctly? And secondly, did you have a comment?
Yeah, it's fine. I'm used to being pronounced loads of different ways. I'll respond to anything really.
Thank you. Sorry.
Don't worry about it. It's cool, Peter. Yeah, I just agreed with the concept that Ian was. I was actually in that breakout room as well, where it's important to keep vulnerable people, whether it's adults or children, when you're doing digital inclusion, to keep them safe, because they are more vulnerable, especially people with mental health problems, people that are like in them situations, they are more vulnerable. And so it's very important to keep them safe, as well as giving them access to all these, the new world we live in their perspective as well. So I think it's balancing both of them. And I work at Airedale Hospital. I'm a youth volunteer coordinator. My manager wasn't able to make this meeting, but she's the patient experience and PALS manager there. So it's been really good. I really enjoyed listening to all these talks and everything. I'm going to be taking a lot of information to her, but it is really about our patients in the hospital, like our dementia patients, the mental health patients, and around getting them to access this information. Obviously with COVID, there's been an increase of amount of people coming to hospital with domestic violence. There's been other crimes that have increased. So, having some digital forums that could tap into them vulnerable groups, would help our patients extremely. So, and any support with, for example, getting iPads and things like that for our ward-based elderly or children wards, to support them as well would be great. So I'm just here really just to hear about anything. But if anyone's got any questions for me, I'm happy to answer it. But yeah, just a thumbs up to say good point, Ian, really.
I've made a point to say, I've made a note here saying you liked Ian's presentation better than mine. So yeah, I've made that point.
No,
I'm playing.
No, that's not true. I like you. You made me laugh. If there was a reaction thing that had someone laughing, I would have been putting that a lot in your presentation.
I'm messing.
Yeah.
Thank you very much. Thank you for that.
There is a reaction that expresses joy, apparently.
Yes,
so,
exactly.
This one, there you go. It's a bit like
Dermot.
Sam, I just say regarding your point, is that we've lost him now. He's gone, which is not unusual. But we did have Justin Tuggy in the group at the beginning, and he's the Chief Clinical Information Officer for Airedale. He's also the CCIO for the ICS as well, so for the West Yorkshire and Harrogate Partnership. So he's my co-chair of the digital program board that I work on. So if you have any particular thoughts on digital inclusion, then you have access through Justin, and he's Airedale. So, by all means, reach out, and you will get a reply eventually. You might get it quickly, you might take a while. You never know. He's quite busy because he has clinical responsibilities as well, like most of these sort of folk. But I think what we actually need in terms of addressing the things of what do we do. Understanding the picture is one thing, but both of these, what is it that we need and what is it that we do, is where we need people who are more on the front line, people like yourselves who are closer to our most needy citizens. So that perspective is absolutely vital. Most of the people I deal with are quite senior and stuff like this, and actually what we actually need is that direct input from people like yourselves. So please reach out to Justin, let him know what it is you need. That's his job. So
good shout, Dermot. Thank you. Can I just ask if Andrea and Sharon, if either of you two have anything you wanted to add, sort of around the barrier stuff? Don't worry if you don't. Just so we can get your point of view as well, if there isn't. And if either of you are talking, you're on mute. But I'll give you a couple of seconds.
Hi, it's Sharon McMahon here.
Hi, Sharon.
Hi there. I think I've I'm involved in the digital agenda from a project and also slightly from a wider view in Work in Public Health, and we're looking at healthy ageing as a wider topic and digital inclusion as a strand of that. But I'm a bit like some of the things that Dermot said. There's people on this call whose names I've heard and people I haven't. So it's understanding what's going on in your patch and who's working on what, and where that is kept centrally and how you access that. And also just understanding very specifically for our population what the barriers are. And I think it's been talked about in other groups and presentations about not making assumptions. We can jump into solution modes quite easily, and we shouldn't do that.
And is the first step in that, Sharon, you getting involved with Dermot's group?
I think it might be.
Yeah. Okay. Andrea, is there something that is there anything you wanted to add? And again, don't worry if there's nothing at this point.
Yeah, I think one of the barriers, I think, for me at the moment is I'm South Yorkshire and Bassett Law ICS. I think what we're struggling with is we all know that there's a problem there that needs some kind of solution. I think it's already been alluded to that it's a bit of an unknown problem with an unknown solution. What I think we're struggling with at the moment is getting that buy-in from the right people to invest in doing some of this co-design work. So we've had our mHabitat proposal on the table for quite some time. I think we've nearly got there now in terms of funding it, but it's taken a while. Even though people recognise that, yeah, there's an inequality there, we need to do something about it. It's taking too long to get that buy-in. Yeah,
so there's something in how do you convert nice conversations into actual...
Yes, yeah, absolutely, yeah.
Rapidly as well.
Yeah, yes.
Is a big thing. Yeah, really good point, Andrea. If everyone's all right, I'm just going to say one thing. I'm not supposed to have an opinion, but I do, so sorry. I think one of the big sort of steps that we've taken in the Widen Digital Participation Programme is who is the right people to do this digital inclusion stuff. And when we make it a digital project, it never goes well. When we sort of embed it into people's roles, not as an add-on, just as here's a tool, it could be a pigeon, it could be an app, it could be whatever, it goes a lot better. So there's something in that to explore. I'm not saying we got it right, but it seemed to improve when we did that. But I was going to say, I think our levers and our priorities will overlap quite a lot. And I'm making notes while you're all talking. And Dermot, you said you need to understand the picture and a lot of stuff under that. And then you need more input from frontline members of staff. People who are in the trenches, I guess, was sort of your point. If I'm misrepresenting, please stop me. Does anyone else have any other priorities or things we should do today, tomorrow, immediately? What are people's thoughts? Shout them up and we'll.
The digital education has really got to be looked at as we expand the digital inclusion programme.
And what does digital education being looked at look like?
Well, we're working on that at the moment, but bringing community groups like we've got with the anti-poverty, recognising the poverty and digital inclusion go to work together. Yeah. It's all interlinked, and that's where we're exploring it, and we seem to be the only ones that are. Dermot will verify that. Nationally, nobody's really looking at digital and financial and linking them together. And we should be, because it's all interlinked. Poverty can be a driver by digital inclusion if people get into the wrong things, go into gambling and into loan sharks and all those sort of things.
There's a whole poverty premium thing as well, isn't there?
Yeah, I'll just back that up and just sort of say that the links between well-being and financial stability, quality of jobs, having a job, all of these things are also well established as well. So, that kind of financial stability and well-being directly connects in with your health and well-being aspect as well. So, and this is something I've heard Kirsten England talk about in the past, and it's been on the agenda for some time. So, and I'm sure Sharon, from a public health perspective, fully gets this. Yeah, you're right. We can't ignore those connections, and that's one of the reasons why I think when we're looking at digital inclusion from a health and social care perspective, we should also be looking to include other sectors. It's not just health and social care. This doesn't stand alone. During the pandemic, for instance, I don't know where you want to put this in, Peter, in the bigger picture. I don't mean to derail, but we saw that there was a huge need within education. We know that Bradford, I think, got about 2,000 laptops they had to dish out to some of the poorest households to have, and some of those kids have an opportunity to engage in some education during that period, but it was a drop in the ocean, to be fair. So education's part of it. Ian's there with the finance. I'm putting there because that's where he is on my screen right next to me. He's clearly, the finance sector is a really big part of that too, I think. And then there's also access to public services, such as through Bradford Council, for instance. A lot of things go through the app these days, the Bradford Council app, and trying to access those things. Not forgetting also stuff around Department for Work and Pensions, this sort of access to benefits and things like that. That's all digital by default these days. And if you haven't got those skills, you can get sanctioned. In fact, quite frankly, you can have any little bit of money that they give you taken away from you because you don't have the access or the skills, whatever it might be. So I think we also need to think a little bit beyond health and social care as part of the place-based picture by working with our partners. And I also think there's a role for private sector in this too. I would actually like to be looking at asking the finance sector, for instance, who have got loads of money, as we know, and a clear corporate social responsibility, to get involved, to get them to start looking at supplying devices and connectivity, but also looking at getting involved in the training and skills part of things as well. And how do they support that? Because, and ultimately, it's in their interests anyway, because if you've got a more digitally accessible and literate population, you've got more and better customers. So there's a clear win-win there.
Just picking up on that, so next year at Dermot, one of the things we've got involved in Safer Internet is some of the fintech companies to try, especially locally, try and inform that. And the biggest test of this is going to be the census, because if people are not digitally included, they're going to get fined because they can't get involved in the census.
We've got 1 minute left, everyone. Tabitha, I know you put your hand up. Can I ask everyone a favour? Just put a direct message to me with any thoughts over the next 10 minutes when we go back to the room about any other thoughts you've had, because I want to really fill this picture out. But I think the first action might be for you 4 or 5 at least to kind of share emails or something. I don't know, just to get yourselves talking if you're not already in a group, if that makes sense. But please just keep adding them into like a private chat to me, and I'll pop them on our screen. But thank you so much.
Yeah, Peter, what are the other boxes you wanted filling in? You looked at challenges.
Just do priorities. Just do what you think moving forward. What is the first thing we should do?